We welcome you into the 8 o'clock hour here at The Drive. Jason Ross, Carmichael Dave, and it's always a thrill for us each and every Friday at 8 o'clock to check in with Dr. Richard Pan. So generous with his time, is so educational for us, informative for us, and we start the hour right away with Dr. Pan on with us. Dr. Pan, how are you today?
I'm doing all right. You know, we're hanging in there.
Yeah, we ask you all these questions just on that realm. You're no different than the rest of us. How have you and, those that you love handled going through this stay at home?
Well, I have school-age kids, so they're home doing the distance learning thing that I know many parents are also trying to work with. I think you gain a special appreciation for the teachers at school when you have your kids at home and you have to try to help teach them every day, just like the teachers do. And then, my wife's a small business owner, so we got through one payroll on April 1st. April 15th is coming up soon, another payroll, and since the practice is closed, no revenue. So, we're dealing with that too, like many other small business owners.
Well, we appreciate, I echo what Jason said. We and obviously our audience very much appreciate your time each and every week. And each week we do this, we get more and more questions piled up now that people are getting used to having this type of access. I'll start with one that I think is probably right in your wheelhouse, Dr. Pan. Again, I became a fan of yours with your incredible work on vaccinations and the importance of those, especially for our young ones. I want to move into something that you've talked about quite a bit, herd immunity, or as you always say, community immunity. Let's talk about that in relation to coronavirus. You're seeing the reports now, people wondering whether or not it's been in California longer than originally thought, that maybe many have already had it, et cetera, why we're flattening the curve much better than many other states. But what are the numbers to achieve community immunity? Are we talking 50%, 70%? What in your mind needs to happen to where we can start being in that realm of herd immunity for COVID-19?
So there's actually a lot of questions that still need to be answered to answer that very question. This is a very new virus. It's only been around, we're only aware it's been around for probably about 5 months or so, or maybe even a little less than that. And so some of the things we still don't know is, for example, once someone gets this disease and they recover, how immune they are and how long they're immune for this disease, right? So we have viruses where, like measles, if you get vaccinated or you get the disease, you're essentially immune for pretty much the rest of your life. On the other hand, you have diseases where, like the norovirus that causes people to get really bad diarrhea, that probably you don't have immunity for as long after you recover, and so you could get reinfected later on. And so the question is how long is someone immune after they recover from this coronavirus? We're hopeful that people will be immune for a while, at least several years, but we don't know because this is a brand new virus. Other coronaviruses, people are immune for a while. So some of the coronaviruses do mimic the common cold, but we don't know the answer to that question. And in fact, some people still do wonder is that if you get the disease, when can you be reinfected? So the hints is that you do get immune after you recover, but we don't know how long. So that, of course, addresses the herd immunity or community immunity issue, right? So if people aren't immune for a very long time after they recover, then that becomes a big problem. Now, one of the promising things is that as they're studying this virus, they notice that it doesn't really change a lot over time. It doesn't mutate in significant ways that would mean that your body, once it reacts to it, probably wouldn't continue to react to it. The virus itself isn't changing all the time. So that's a positive sign for both more long-term immunity and also for the likelihood of having an effective vaccine eventually. So those are good signs, but we still don't know. And then the question is that assuming that you do develop long-term immunity, what percentage of people need to have immunity in order for you to have this community immunity effect? And again, because we don't know all the answers to the questions about this, but I think some people have sort of put a guess probably around like 80%. But again, that's a guess. I don't want anyone to say, "Oh, well, you said 80%," and it turned out it isn't. So, but it's you'd have to think about it. It's probably higher, certainly higher than 50%. But right now, the only way to get there is for that percentage of people to get infected and recover, and given the fact that so many people get hospitalized with this, even if they don't die, even if you're young, we don't really want that to happen. So that's going to be one of the challenges.
Dr. Pan, do you believe that first part of what Dave was asking, though, that maybe it had been in California earlier than we recognize? Is there data that backs that up for you?
So, first of all, it's certainly much more widespread than the testing would indicate, because we were only able to test a fraction of the people, right? So, and as we pointed out before, many people who get this virus either have mild or no symptoms, and so we don't really know. I think there are some studies out there. I understand Stanford is doing a sample of people where they're testing people with the serology or antibody test, which would indicate whether you had the disease, and trying to get an idea of that. I think they're just sampling people in the Bay Area or Santa Clara County, so it wouldn't represent the whole state. So that may give us a better idea about how many people or what percentage of people in California might actually have already gotten the disease and been immune. We'd have to do broader studies than that. But that might give us a better idea of how far along we are. But at this point, we still don't know, because we haven't had an opportunity to do studies like this to figure it out.
Dr. Richard Pan joining us, also a state senator, and obviously a guy who knows his stuff in the medical world. He joins us each and every Friday at 8:05. So we've been hearing a lot of talk about rollouts, gradual rollouts in waves, different states, different countries. Dr. Pan are obviously going to be at different stages of the curve, if you will. So you are also a state senator, so you have an understanding, in addition to medicine, of politics, and that's also a world you live in. I'm going to appoint you the czar of the economic rollout here for just the heck of it. Do you see a feasible way where we could have a staggered rollout and not affect our borders, both internationally and domestically? I find that's incredibly interesting to me, how you would be able to roll things out yet still have free-flowing borders, again, both domestically and internationally. Do you think those types of shutdowns and or testings before you get in with documentation, is that going to, in your opinion, need to be part of that rollout to prevent a relapse?
So that is an interesting question. For example, the United States is a very large country, and you can see different parts of our country are at different stages, and actually we're doing very well relative to other parts of the country. When I say very well, we still have a growing number of cases, and we have a growing number of deaths, and that's a tragedy. But we're certainly at this point, because we've been able to do the physical distancing and staying at home, we are doing much better than places like New York City and right now Detroit and New Orleans and some other places. So in terms of the next stage, what we need to do is we need to have a better handle of where we are and where we're going in terms of where the disease is. So that sort of goes back to the question you asked about, well, where are we with the community immunity piece, right? We need to do more surveillance, and we need to greatly ramp up our testing capacity. So right now we do about 10,000 tests a day, roughly. I think our goal is to get to 25,000 tests a day by the end of the month. We need to get much larger than that. That's going to take some work and effort, but we need to continue to expand our testing capacity so we know where we're at. Now, then the question is about border controls, right? And if we look at what some of the countries in Asia have been able to do, who have been more successful in getting this infection under control, they do have fairly strict border controls where they say if you come into the country, you need to be quarantined, you tested and quarantined 14 days to be sure that you're not bringing it in. Now, one of the things that I should point out that California, as much as we talk about being a nation state, we're part of the rest of the United States, and we're not allowed to impose, well, let's put it this way, not allowed is probably not quite the right word, but there might be challenges to us imposing border controls about people entering and exiting our state to other states within our own country, right? We're supposed to have free passage. And so since the rest of the country are at different stages and different states have made different decisions, that might be more challenging in terms of being able to control who comes in and out of state with the disease who are coming from other states. And so that's going to be an interesting question because right now we don't have consistency within this country in terms of decisions people are making. It's sort of a state-by-state decision. And so what do you do if someone's coming from a hot spot in another part of the country coming to California, and can you actually try to impose a quarantine on someone who's trying to enter California from another part of our country? And I would just point out that the real issue, certainly we are concerned about cases coming from other parts of the world, but it's already here. It's in our state. We're keeping it under control because of the things we're doing, the stay-at-home order and so forth, but it's also in other parts of the United States as well. And so that creates some challenges.
Dr. Richard Pan with us here on The Drive here on Sports 1140 KHDK. I want to ask you about the actual virus itself, something you said earlier, that it doesn't mutate often. And I guess, for lack of a better term, I guess I'll ask it this way. I know when you get the flu shot every year, they kind of prepare for different strains of that. Is that helpful in finding a vaccine or medicine for this, that it doesn't mutate? Or I guess explain why that might be beneficial to those trying to figure out more about this, that it doesn't mutate often.
Right. So, for example, the flu has many different strains, and so different strains dominate. That's why we don't have a universal flu vaccine yet, right? So you have to get one every year for that particular season. HIV is another virus that tends to change a lot. We still don't have a vaccine for that one. So it makes it much more difficult to have a vaccine if the virus mutates significantly. Because what happens is that means that you can, how a vaccine works is that you provide essentially a sample of the virus, and the body learns to recognize, like a wanted poster, right? But can you imagine that the virus instead changes its appearance all the time? So that wanted poster isn't very useful for very long for your immune system. And if you want to take that analogy, a virus that doesn't change its appearance, doesn't mutate significantly, makes it much easier for the immune system to be sure that once you've survived the infection, that when it shows up again, that your immune system will recognize it. Or if you have a vaccine, that will recognize it, and that it won't change over time in a way that makes that vaccine eventually become ineffective. And so that's actually a positive sign that looks like this virus is fairly stable in that way, and it makes it more promising both that if you recover from the disease, that's much more likely that you're going to have a longer immunity. We don't know for sure yet, but this is a positive sign for that. And then if you do develop a vaccine, that vaccine will provide longer immunity as well and be more effective. So those are positive signs, but we need to turn those signs into reality.
It's Dr. Richard Pan joining us. Doc, you are uniquely qualified to answer this question. It's a debate that is growing and will be raging soon, if not already. Hypothetical. We find a drug that is able to kill off the coronavirus. We've heard 18 months is about what you need to do the trials necessary to be able to feel comfortable prescribing this thing. But if situations arise, which I'm sure will, where you have a drug that you have identified that could kill off the coronavirus, but you do not know, we're only in month 1, month 2, you do not know what the long-term effects are, and you have a patient that is terminal, that looks like they're not doing well, they're going to die from this thing, you're their doctor, and they say to you, Doc, listen, I'm going to die anyways, I'll take my chances, I want this. If I get beat by the long-term effects, I get beat by the long-term effects, but I know I'm going to die of coronavirus. As a doctor, would you ethically feel comfortable prescribing that?
So what we really need to think about is that right now we have no treatment for this virus. We have different ideas. People have suggested different things, but we don't actually have a treatment we know that definitely works. So you have that circumstance you talked about what we really need to do, and we are kind of doing it right now, is that we set up, we take things that are promising, that whether because we looked at the biology or there's some indications it's promising, and then we do clinical trials. And so that's how we're going to figure out which ones work or which ones don't. And so when we still don't know, what we need to do is encourage people to sign up for these clinical trials. And so when you're talking about the circumstance that you talked about, the best, ideally, what would happen is we'd say, well, we have a trial in which you may be able to get this treatment, and we will see if it works. And if it does, well, that's fantastic. That helps inform the next person's treatment, right? But if it doesn't, then we know that doesn't work, so we add to our knowledge base. And so, but if we don't do things systematically, then the problem is we prolong the period of time in which we don't know what works and what doesn't work. And so I know that it can be really frustrating when the scientists said, well, okay, well, what we want to do is we're doing a trial, and do you want to enter a trial? And you're going, well, does that mean I definitely get the drug or I don't? But that is the fastest way for us to get to the place where we actually start narrowing down what might actually be effective and what would actually help people, so that hopefully we get past the point where you're saying, I just want to try something, and to the point where I can offer you something that actually would have at least some improvement in your outcomes.
Dr. Pan, I'm thinking about all those that might be listening that have done, hopefully, all the guidelines, and it's kind of grown. Of course, we were told right away, wash your hands. We've done that. Hopefully, people are still doing that with intention here. Social distancing has been practiced, not perfect, but it's been done pretty well. A lot of people are working from home, and now when people are doing those essential trips, more and more, if not everybody, seemingly wearing masks. Is there another step, or is it just more of what we've been doing?
I think continuing to do what we're doing is showing that we're having an impact, a strong impact. I do think that as we look at the numbers, we try to figure out if there are more things we need to do. We certainly need to be sure our essential workers can continue to do their jobs and that we protect them so that they don't get sick. We also need to be sure that we slow the spread of this disease in a way that prevents our healthcare system from being overwhelmed. We also want to sure we have enough of a balance so that our kids get educated and people who are able to go to be able to make a living safely can make a living. But also I would keep in mind that this is not a choice between public health and the economy. Sometimes people pose that, saying that, we're putting all these things, and certainly I understand people are suffering. People have lost their jobs. We have record unemployment. People are struggling to figure out how to pay their rent, how to pay their bills. Lifting these restrictions all that will do is increase the amount of hospitalizations and death and fear, and that's really what is impacting our economy. In fact, even before we put the stay-at-home orders, I think you think about the attendance at the Kings games before we stopped having them. They were down, right? People going to restaurants was already going down because people were afraid. They're afraid of getting sick and potentially dying. So that is what we need to do, is to get control over this infection to show that we can get this under control. And so that right now, that means continuing and persisting in doing the distancing, staying at home, staying apart from each other. When we, staying 6 feet away, the masks help, but it's not a substitute for the staying at home and staying 6 feet away and washing your hands frequently. So do all of those. So far, it seems like that our efforts in doing that have been successful so far. So we need to keep doing it. And in the meantime, we got to ramp up testing so we can better identify who has the disease and who might hopefully be immune to the disease, which would then allow us to start thinking about, well, how can we move forward and perhaps lift some of the restrictions if we're able to identify who has the infection, who would need to be quarantined to prevent its spread, and who might not be at risk anymore from, or at least much less of a risk from getting the disease. So that's a process that will probably take months. But we need to hang in there, and I know it's difficult, but people really are doing a really good job here in Sacramento region, and you can see the results both here and in California at large in terms of what we're able to do.
Dr. Pan, we just have a minute left, but I don't want to let down the listeners who had a couple of questions that I thought were incredibly pertinent. So question number one, you talked about water and soap as the best thing to fight the virus. If hot water and soap is a 10, here's a question somebody had that blew me away. What is cold water and soap? A lot of people don't want to wait for the water to get hot, so what's the difference in your opinion?
Oh, actually, you know what? I don't actually say hot water and soap. I say water and soap, okay?
Oh.
And that's because you're not going to make the water hot enough to actually basically destroy the virus, right? Because otherwise it'd be so hot you'd be burning your hands. So if you want to use lukewarm water, that's good. Cold water and soap works as well. I mean, probably lukewarm's probably better, at least, because it makes the soap a little more effective. But actually, the most important thing is soap and water. So I wouldn't worry so much about the temperature of the water.
And then last thing, and I'm putting this at the end, this is a long answer, but people want to know. We're on a sports station. Right now, today, your best guess. Do you see a feasible way in this calendar year, meaning between now and December 31st? In your mind, first instinct, do you see a feasible way that we will be able to have sporting events with fans between now and then?
You know what? That's a very difficult question to answer because it really depends on what we learn about this virus and what we're able to do. So let's put it this way, we're not going to get a vaccine in less than 18 months, and that's only if everything goes perfectly. Will we invent or identify a treatment that might before then? Probably, don't know. Probably unlikely, but it's possible, and that would then allow us to, if we have a treatment that could, prevent people from ending up in the hospital with this disease. There's that opportunity. As I said, in the absence of those two things, which will take time, then we're talking about, let's say we can get to doing massive testing and quarantining and so forth. I think the challenge is going to be is even in that circumstance, we probably don't want people being in very large crowds, like a bunch of people in a stadium together, right, or in Golden One. This disease also tends to spread in clusters. So what we're seeing is that there are particular events where large numbers of people are together for an extended period of time. So you think about a basketball game, a Kings game, and we're all sitting shoulder to shoulder each other in Golden One for a couple hours for a game. That creates a high risk of spread for this disease. So I think it would be a challenge to actually have people having games where you have people in, let's say, Golden One or an arena with fans all shoulder to shoulder in watching a game. It's not impossible, but I think probably before the end of the year, it's probably unlikely. Now, they can play games and we can broadcast them and all that, but probably allowing a packed Golden One, I won't say never, but I would think that at this point in time, probably not. But again, there's a lot of months between now and the end of December, so we don't, depending on what we know and what other developments happen, we'll have to see.
All right. Well, Dr. Pan, we always enjoy your time. Your insight's incredible. Stay safe. Have a great weekend. We look forward to talking to you again next Friday.
Okay, thank you. And this is an important weekend for many people with Easter and it's Passover. So everyone, please stay safe, stay at home, worship in your home. And again, thank you so much for having me.